Hello, family and friends. Last week, we started the discussion about coronary artery disease. So now that we know what coronary artery disease is, let's find out if you're at risk. Here are the risk factors. Number 1, getting older. Number 2, sex. Men are typically at a greater risk. However, the risk for women goes up after menopause. Number 3, a family history of heart disease, especially if your father or a brother was diagnosed with heart disease before age 55, or if your mother or a sister was diagnosed before age 65. Number 4, smoking is a huge risk factor, and being exposed to secondhand smoke also puts you at risk. Number 5, high blood pressure. Number 6, high total blood cholesterol. High level of HDL cholesterol, also known as the bad cholesterol, or a low level of HDL cholesterol, known as the good cholesterol. Number 7, diabetes. Number 8, being overweight or obese. Number 9, lack of exercise. Number 10, constant stress. Number 11, being of African American, Mexican American, Native American, Native Hawaiian, or Asian American descent. Number 12, did you know racism fuels hypertension? Several studies have been done that have shown racism fuels high blood pressure in African American people. Blacks who endure life-altering instances of discrimination are a third to 1.5 times more likely to develop high blood pressure than those who have not been similarly traumatized. This was reported by the Journal of Hypertension in July 2020. Number 13, eating an unhealthy diet consisting of foods high in levels of saturated fat, trans fat, salt, and sugar, which is unfortunately characteristic of the typical American diet. Risk factors frequently occur together, and one may activate the other. And the more risk factors you have, the greater your likelihood of developing coronary artery disease. And what is even more concerning is the appearance of major cardiovascular risk factors in our children, including obesity, elevated cholesterol, hypertension, and sedentary behavior. Now I want to switch gears and touch upon some less commonly known risk factors, such as sleep apnea, high levels of certain blood tests, including CRP or C-reactive protein, triglycerides, and homocysteine. Preeclampsia. This condition can develop in women during pregnancy, causing high blood pressure. It can result in a higher risk of heart disease later in life. Increased alcohol consumption, and people who have autoimmune conditions such as rheumatoid arthritis and systemic lupus. Lastly, there is mounting concern about the possible heart health risks associated with certain plastics. Some plastics can leach into food and beverages we consume, which may lead to an increased risk of heart disease. Well, that's it for today. Join me next week. We will look at the symptoms of coronary artery disease.